Hi, everyone, and welcome to tonight's webinar. This is another session in the Integrative Therapies series. Tonight's topic focuses on improving strength and balance after treatment for cancer. Before I turn it over to our speakers this evening, just going to go over a couple of housekeeping items. We're so thankful that you're here with us tonight. Just to minimize any audio distraction, you are in listen-only mode. But we do encourage your questions, and at the end of the session, we'll have time for Q&A. You can type your question into the chat box, and I will ask it to our presenters. Only myself and the presenters will be able to see your question. The session tonight is being recorded, and it will be posted to our website for anyone that may have missed it or would like to watch it back. And lastly, we just ask that you don't share any personal medical information or questions in the chat box. If you do have a medical question, please ask your doctor. And now I'd like to introduce our presenters for this evening. Dr. Sasha Knowlton is an assistant professor and assistant director of cancer rehabilitation at Harvard Medical School. Dr. Knowlton is board certified in physical medicine and rehabilitation. Her clinical and research interests are in cancer rehab with the goal of improving the function and quality of life of cancer patients during all aspects of cancer treatment and survivorship. Loren Winters is an oncology nurse practitioner, yoga teacher, and the associate director of breast survivorship at Mass General Cancer Center, Waltham. She has special interests in cancer survivorship and the use of integrative therapies for health and wellness. In addition to her professional practice in medical oncology, Loren provides lifestyle medicine consultations for patients at the Cancer Center as part of the Innovative Lifestyle Medicine Clinic. Thank you both for being here, and I turn it over to you now.
Thank you, Devin. I'm just going to share the screen. Okay, so our presentation this evening is entitled Improving Strength and Balance After Treatment for Cancer. And again, I'm Loren Winters. I'm happy to be here tonight. So the goals of our talk tonight are to discuss some strength and balance problems related to cancer. We'll talk about some of the common causes, the prevalence, and the risk factors related to those problems. We'll go through a description of symptoms, and then, of course, talk about treatment strategies and self-care. So strength and balance problems related to cancer or cancer treatment can make it quite hard for folks to function as they normally would do, and then also to perform the everyday activities of one's life. So some of the functional issues related to cancer and cancer treatment include impaired balance and strength, and these can cause an increased risk for falls and even injury, a reduced independence in mobility, and also an increase in need for assistance with activities of daily living, also known as ADL. So these are the getting dressed and groomed for the day, bathing or toileting, having food prepared, feeding oneself, walking and transferring from, for example, chair to table or exam table, for example, or in the car, that sort of a thing. And then in addition, it may impact the need for increased assistance with instrumental ADLs, like managing finances or transportation, shopping, meal preparation, and home maintenance. It may impact quality of life. So that is basically a degree of a sense of health, comfort, and ability to engage in and enjoy the activities of life. And then addiction may impact economic, and there may be social concerns. This may include the ability to return to work, manage your household. It also may impact your ability to maintain social connections. It also, may impact one's roles, one's purpose in life, and create a change in dependence on other people. And an example I think of might be a parent who's more so depending on their adult child for care. And then impairing mental health. So that might mean the loss of function and how that impacts one's mood. Self-esteem can also lead to one feeling discouraged or having a loss of a sense of purpose, as I mentioned earlier, or a loss of a sense of autonomy, even anxiety and depression. Getting the hang of this now. So some common causes for strength and balance problems. We're going to go through these causes and then get into each one in a little bit more detail. Fatigue, chemotherapy-induced peripheral neuropathy, cancer of the brain, central nervous system, head and neck, muscles or bones, pain and the use of pain medications, chronic medication use, and then deconditioning. So fatigue, it's probably the most common, as you can see. The prevalence is quite high. 80 to 100% of people with cancer report fatigue at some point in their treatment trajectory. Risk factors related to fatigue include recovering from surgery, chemotherapy, any of the treatments, radiation, lowered blood counts. So this means this is a lack of typically the red blood cells, also known as anemia, that may impact the ability of the cells to carry oxygen to your body's muscles and tissues, resulting in feeling tired or weak, even short of breath. Anemia can be acute, can occur suddenly, or chronic and be quite long term depending on the cause. So it can be identified with blood tests, and it's a common side effect of many types of chemotherapies. Changes in blood chemistry, certainly electrolytes, those are our body's salts, can impact fatigue, malnutrition, infection, hormonal changes, stress and worry, reduced physical activity, and pain. So what does fatigue feel like? It's often described as a lack of energy. Maybe someone might have to spend more time in their bed or chair than they'd like. It may even lead to sleeping problems. It feels often like you can't manage necessarily your everyday activities, or you just don't feel up to it. Not feeling rested, even after a decent sleep. And then finally, feeling washed out or drained, like the picture here is a great description that we might hear. So I'm going to pass it on to my colleague, Dr. Sasha Knowlton, to talk about chemotherapy-induced peripheral neuropathy.
Wonderful. Thank you for that introduction, Loren, and thank you for inviting us both, Devin, to do this presentation. So neuropathy from chemotherapy is probably the number one thing that I see and treat. It's often described as a damage of peripheral nerves, and I've included a basic anatomy diagram, if you will, of a nerve for those of you who are unfamiliar with these cells look like. And generally, neuropathy from chemotherapy can present in different ways. Generally, we think about neuropathy coming from chemotherapy as a length-dependent process. And what does that mean? That means that the longer nerves are typically affected before the shorter nerves, which is why during chemotherapy or shortly after completing chemotherapy, if you're going to get neuropathy, you'll typically notice it in the fingers and toes, typically the toes before the fingers. And then it starts to work its way up towards the hands and feet, and even higher up in the arms and legs. Next slide. So how common is peripheral neuropathy from chemotherapy? So there's been a lot of study into this because it is so prevalent. Almost 70% of people experience some level of neuropathy about 1 month after they've completed their course of chemotherapy. And not all chemotherapy causes neuropathy. There are common offenders, if you will, which includes Taxols and platinum agents and others as well. However, it doesn't go away right away. Up to 30% of people experience ongoing neuropathy 6 months after completing treatment. And many people, depending on the level and severity of neuropathy, experience it for many months and even years afterward. People are more likely to experience neuropathy depending on certain risk factors. If you have underlying neuropathy, the most common being from diabetes, you're more likely to experience neuropathy during your chemotherapy regimen. Additionally, unfortunately, age, if you're older, you're more likely to experience it as well. If you're a smoker, if you've got an underlying kidney dysfunction, that also puts you at risk for development of neuropathy. And when I talk to patients about neuropathy, I typically divide symptoms into both positive symptoms and negative symptoms. Positive symptoms include symptoms in addition to what you normally experience, which unfortunately is most commonly pain. People can also experience tingling, pins and needles sensation, and hypersensitivity to things that should not be sensitive, such as certain fabrics. Negative symptoms or lack of symptoms are also experienced. They include weakness or lack of strength, numbness or lack of sensation, and also, which I've bolded here, impaired proprioception, which can be described as joint position sense or a general sense of where your body is in space. And this particular one is important because it impacts your balance. Surprisingly, when talking with a number of my patients, when I start asking about their neuropathy and I start questioning them about balance, they say, oh yeah, you're actually right. My balance is getting worse and I'm holding onto walls more. I've noticed that I trip over my own feet more. And that's because from the damaged nerves, you can't tell where your feet are in space. Next slide. So another common cause of impaired or impacted strength and balance is often pain. Pain is quite common, unfortunately, in both cancer survivors and people who are undergoing active treatment for cancer. Over half of all patients report some level of pain. Understandably, pain impacts multiple facets of life. It can impede the ability to work, do everyday activities, which Loren described earlier, which includes day-to-day activities such as what we call ADLs, which can include things like bathing and dressing. It can also impact your ability to get a good night's sleep. It can impact your ability to eat, particularly if it's causing nausea because you're in so much pain, or if it hurts to swallow. And it can also impact your ability to be social with others, which is a common thing that we all like to do. Risk factors for pain are numerous. It depends on the type of cancer. It depends on its relative proximity to other structures. And certain treatments, such as surgery, can also cause pain. Next slide. So when I'm asking and talking about pain with patients, I often want to clarify the different descriptors that they use to describe their pain. Pain can be described as aching or dull. It can also be described as burning when discussing nerve pain in particular. Sharp pain is also present. And you also want to figure out the timing of pain. Is it something that's constant, or is it something that's intermittent and occurs with only certain activities, such as walking or going up and down stairs? Getting an understanding of the severity of pain is also important. A lot of times we'll ask patients on a scale of 1 to 10, which you've shown a diagram of here, how severe it is. I often say, 0's no pain. 10 is the worst possible pain, such as childbirth or getting in a car accident. And a lot of times people are somewhere in the middle or at one or another extreme. And it's important to get an understanding of how severe the pain is because you want to know how much it impacts their day-to-day life and also quality of life. So even though it may seem difficult to understand the type and describe the type of pain that you're experiencing, it's actually really important because it helps lead us clinicians down different diagnostic pathways and help us figure out what is exactly causing your pain, causing you to have so much discomfort and limited function. And that way, once we figure out the cause, we can better adequately treat it. Next slide. So another issue that can cause impaired strength or balance are cancers of the muscle system or of the nervous system. We've listed here some statistics in terms of cancers of the brain and nervous system, which includes the spinal cord and also nerves, including peripheral nerves, which are the nerves in our arms and legs. Bones and joints are also, you can also get cancers in, and more advanced cancers or metastatic cancers where the primary cancer may have been a breast cancer and it may have traveled to the thigh bone or femur or the upper arm bone or humerus or other bones as well, including the spine. The risk factors, again, for experiencing cancers of these particular areas and resulting impaired strength and impaired balance include the type of tumor, how advanced the disease is, and then really other environmental factors as well. Or social status can also obviously impact whether or not strength and balance are impaired. Next slide. Here are some of the symptoms that cancers of the nervous system and cancers of the musculoskeletal, meaning the muscles and bones, can cause. Obviously, if you've got a headache, if you're irritable and you're drowsy, your strength is going to be off, as is your balance. If you're weak, I mean, you're going to have problems with coordination and walking and getting around. In terms of cancers of the muscles or of the bones, you can have pain, which causes your strength to be off and your balance to be off. You can be at risk for a fracture, which everyone likes to avoid. And overall, it can do a number on your system, make you feel quite fatigued. Next slide. So another common cause of impaired strength and balance in cancer survivors are actually medications, some of which are used quite commonly in cancer survivors and some of which non-cancer patients use as well. Antidepressants and anti-anxiety medications, a lot of times we'll feel people feeling fatigued and sort of out of sorts. Additionally, steroids are notorious for causing impaired strength. They actually cause a well-known phenomenon when used long-term called steroid-induced myopathy, which affects the bigger muscles in our body, such as the shoulders, the back, and the hips, which cause us to be quite weak and have difficulty transitioning from a chair to standing and doing other activities, such as going up and down stairs. Anticholinergics and antihistamines, both are notorious for having lots of side effects associated with them, often making people sleepy or fatigued. Blood pressure medications, particularly if they're making your blood pressure lower, and this also goes with cardiac medications, if they're making your heart rate lower, you're going to experience more fatigue and be more tired. Diabetic medications, including insulin, can reduce your blood sugar, of course, and when your blood sugar is low, you're going to feel more tired and have less strength. And sleep agents, of course, can have a hangover effect, which can also impact your strength and balance. Next slide. So deconditioning, I see this in a majority of my cancer survivor patients that I treat. What is deconditioning? So there's different definitions, if you will. Overall, it's a change in function after a period of inactivity or reduced activity. It's important to see if someone's deconditioned because it increases the risk for falls. And I hate when patients fall because it sets them at risk for injury, not just bruising, but also fractures and potentially hitting your head, causing a brain bleed. It also causes a functional decline. When people are deconditioned, they find it tougher to move around and they find it more difficult to get going and doing things and completing day-to-day tasks. It causes worsening of function in the skeletal system, or the bones, the muscle system, in the heart and blood vessels, because you're not pumping blood as efficiently throughout your body. So your muscles are not getting as much oxygen as they should. And your lungs can also get deconditioned. And we see this quite commonly in the hospital, where people are in bed for so long and they find that they get short of breath, even just sitting at the bedside, or moving from the bed to the chair and taking those couple of steps. So deconditioning overall, yes, it's related to muscle function, but it can obviously impact strength and balance as well. Next slide. So I'm going to digress a little bit and explain exactly what cancer rehabilitation is, because my subspecialty within physiatry, or physical medicine and rehab, is a cancer focus. So Cancer rehabilitation is a relatively new field. This is one of the first citations of it, which was in the late 1970s. And overall, as a cancer rehab doctor, I work with patients on increasing functional independence, addressing and trying to improve pain, weakness, and other symptoms that impact function, which includes bowel and bladder function, trying to prevent other complications. As I mentioned, falls is a big one because I hate when my patients fall, and overall trying to improve quality of life. Next slide. So taking a step back even further is, what is a physiatrist, which is what I am, because a lot of people have never even heard of the term, and it's actually a relatively new field that was started in the 1940s. So it's a specialty of physicians like myself that treat individuals with impairments and disabilities. Impairments meaning lack of something, or such as lack of strength or something like that. Traditionally, my field has addressed individuals with spinal cord injuries, after stroke, traumatic brain injuries, and other impairments. But now, as you can see, and being a part of the MGH Cancer Center, there's a bigger focus as well on other populations, including cancer survivors. And collectively, as a group, this group of physicians are called physiatrists. Next slide. So what do we do? And I stole this list, if you will, from one of my Academy websites because I felt it was a good summary of it. So we treat patients of all ages. We focus on really addressing function and quality of life. We have a really broad medical expertise that allows us to treat disabling conditions at time of injury, but also many years down the line. We can diagnose and treat pain in the setting of injury, illness, or a disabling condition. We also work on preventing any injuries as well. And I work very closely with physical therapists, occupational therapists, speech therapists, and other physician extenders to really optimize patient care. We're not the same as physical therapists or other therapists, and I get that question quite commonly. They have an area, huge area of expertise, and we have our own area of expertise. So we're sort of team players, if you will, working together. We also work with other physicians, which I've listed some of them here. And a lot of times we're thought to be the quarterback of a particular case, really, sending the ball or the patient or the particular issue to other specialists as needed, depending on the functional issues that may come up. And we really tend to treat the whole person and not just the problem area. Next slide. So how can we treat impaired strength and balance in cancer survivors? So really, we want to do an overall thorough evaluation for any underlying factors that may be contributing. So whether you see Loren or myself or another clinician, we really try to understand, what is setting you up for your issues in particular, and what else could be contributing. Sometimes it's a question of the chicken or the egg, but a lot of times it's lots of different pieces of the puzzle. Depending on what those factors are, we really want to treat them and address them appropriately. A lot of times, appointments will focus on education and really, what is safe? What's a safe thing to do? What is causing this? How can we prevent this or improve it? Depending on the particular issue at hand, getting patients in with the appropriate physical therapist is extremely important. Not every physical therapist is created equal, and there's different schools of thought. And I work with a lot of physical therapists in the greater Boston community, and I sort of know who my good therapists are, and I send people to them. And it's also really signing up for a change of lifestyle. I liken exercise to my patients who have impaired strength and balance to brushing your teeth. You have an issue, which is the underlying impaired function and whatnot. And when we brush our teeth, we aim to prevent cavities and prevent gum disease and be healthy. Exercise can sort of be thought of as the same way in the cancer survivor population. It's really signing up saying, look, I'm going to take charge of things. I'm going to improve the issues that I have going on. I've got this predisposition, if you will, to having issues. I'm going to really take charge and try to change that. So it's signing up for a change in lifestyle. Next slide. So how does a physical therapist approach balance issues? And really, the big takeaway is that there's no one size fits all approach. If you see that with a physical therapist that you're attending, it might be a good idea to get a second opinion. And the reason why is, after talking with three of my trusted physical therapists in the community in getting their feedback, they all really said the same thing. They approach each patient encounter differently, and they create an individualized program depending on the specific issues that may be at hand, whether it's balance or strength. Specific evaluations that are done in physical therapy include static balance, so standing still, corner-based balance exercises, which are done more commonly, I would say, in static balance, but also balance exercises. And what this means is static means staying still, not moving. When you do it in a corner with two when you're in a corner and there's two walls, if you wobble, you can catch yourself. A lot of times I actually recommend doing this with a chair in front of you. So if you topple forward, you can use the chair to catch you. When you're doing these balance exercises, a lot of times varying the feet position, whether the feet are next to each other, whether the feet are in tandem, meaning the sobriety test, as I like to tell patients, one foot in front of the other, or simply standing on one foot to assess balance. Additionally, trying different surfaces, including a floor or standing on a pillow, is a good assessment as well. Changing the rotation or the position of the head, whether the head is stationary, looking forward, or whether you're rotating your head side to side, is also an effective way to assess balance. Sit to stand is a good strength assessment or overall evaluation. This chart that's listed here is what we call norms, if you will, of ages and what is considered normal. So one of the tests that my, again, trusted physical therapists like to use is the 5 sit to stand test. And I have a picture of this demonstrated on the next slide. What patients do, and you can see this in the upper right-hand corner, is they're instructed to cross their arms, stand up, and then sit back down. And they try to do that 5 times as quickly as they can. And they want to see how long it takes you to do that in seconds. There's normals, as I said, depending on your age. And if you fall outside that realm or you take longer, then that suggests that the bigger muscles in your body are weak and they're an area to be improved upon. Next slide. So important factors for improving strength and balance. It's important to meet where a patient is and really progress them from there. I tell people if I went out and tried to run a marathon right now, I would be, not in very good condition. And the thought is the same in terms of telling people to exercise. You can't just tell every single cancer patient to start walking and exercising 30 minutes, 5 times a week. It's not going to happen. Really meeting them where they are, seeing what their level of function is, and then progressing them from there. Making sure they're wearing appropriate shoes. Now that we're entering into summertime, flip-flops are terrible. I hate to say it. As are sandals, as are nice fancy high heels. Making sure you've got good sneakers and good footwear is important especially for balance, but also for strength. Making sure you're getting regular physical exercise, overall avoiding inactivity, so not being a couch potato, and returning to normal activities, including, showering and walking around the house and cleaning as much as you possibly can. Also, adjusting to the environment. If you're going to go for a walk in downtown Boston, make sure that you have someone or something to help you walk on the cobblestones. Same thing in the house. If you've got loose rugs, tripping hazards, then it's important to address those so you don't topple over them. Next slide. Go ahead. I'll turn it back over to you, Loren.
Thank you, Sasha. And I can tell you all that I refer to Sasha on a regular basis. And I think we are just so fortunate to have her and have cancer rehabilitation service as part of our cancer center. It's phenomenal. So as Sasha was saying, exercise is so important, but why? But why? So in 2018, the American College of Sports Medicine updated their exercise guidelines for cancer patients based on an extensive review of the research. And then the American Cancer Society reviewed that and updated their guidelines based in part on these findings, really emphasizing the importance of exercise in cancer prevention as well as reducing cancer recurrence. And we'll talk, of course, about the additional benefits. So exercise does have the effect of reducing the chances of cancer recurrence in certain cancers, and these are mainly breast, colon, and prostate cancer. Additionally, improving survival in these specific types of cancers as well, before and after diagnosis. And then exercise is also associated with a lower risk of developing certain cancers, that of the colon, the breast, the kidney, the endometrium, the bladder, the stomach, and the esophagus. And then finally, exercise, of course, counteracts sedentariness, which is sitting for long periods of time during the day. And sedentariness has been associated with cancers of the lung, endometrium, and colon. So certainly these are pretty powerful effects of exercise. But it also helps to reduce symptoms like fatigue we've been talking about throughout this presentation, and also can improve mental functioning, specifically in the area of memory and focus. And then on a functional basis, exercise can help improve the ability to return to work and everyday activities. So again, hopefully we've convinced you that exercise is important. And what are some ways that that we might recommend or talk to you about exercising at home to improve strength and balance? So there's really, again, just like physical therapy, no one size fits all approach. It really should be an activity that you actually kind of like, right? It should be somewhat joyful. It doesn't mean it's going to be easy right away, but it should be something that you might actually like to do. And so these are just some suggestions, some ideas using a recumbent bike at home, a stationary bike, a stair stepper or a stair climber. And you can see how those two, especially the stair climber, really equate with function. Of course, walking. We'll always talk about walking if that's possible and appropriate. Swimming, of course, is an all-body aerobic exercise, easier on the joints. Stretching, good stretching exercises are really helpful. And yoga is a wonderful choice. We have an online calendar through our supportive care, integrative therapies rather, the supportive care calendar on our integrative therapies website that lists yoga classes that we offer through the Cancer Center. These are free and are able to be accessed virtually. Tai Chi and Qigong movements, I'll talk a little bit about that in a future slide. And then we also have some exercise videos available on the Lifestyle Medicine Clinic homepage, which we can show you. So again, these are some suggestions. There are maybe even many others. So yoga, this is a near and dear topic to my heart as a yoga teacher. It's my side job. So yoga for strength and balance. So what's yoga before I get into the benefits? Yoga is a mind-body practice with a 5,000-year-old history in ancient Eastern philosophy. There are many, many styles of yoga, too many to count or list, but all combine physical postures, which could be standing or sitting, but typically involve a sequence which involve all the major muscle groups and emphasizes having full attention on your body in space and how you feel in the posture. So it's a little bit of that proprioception skill building that Dr. Knowlton mentioned before. It also includes breathing techniques that help to calm and focus the mind. Those feel good. And then oftentimes some form of meditation and then relaxation, my favorite part at the end, the Shavasana. Yoga is essentially a low impact exercise. It should put minimal stress, if done properly, on the joints and the muscles. And again, it may depend on the type that you choose. Yoga can be modified for nearly any body or physical and mental condition. And there are several research studies that have been done that have shown the benefits of yoga in persons with cancer or cancer history. So in particular, I'm highlighting here a research study that looked at yoga for chemotherapy-induced peripheral neuropathy and fall risk. This was a randomized controlled trial that was published in the JNCI Cancer Spectrum in 2020. And this study looked at a yoga intervention versus usual care in 41 participants with breast or gynecological cancers who had reported moderate to severe chemotherapy-induced peripheral neuropathy, pain, numbness, or tingling for at least 3 months after their chemotherapy. So they were randomized to either this yoga intervention, which focused on breathing and musculoskeletal conditioning, or usual care. And so what they found was that in the yoga group, a functional reach, which is an important predictor of fall risk, had improved, whereas in the usual care group, functional reach actually declined. So that was an interesting read for me and very validating. So yoga is also known to be safe and effective in people with cancer, safe actually as exercise, typical exercise. And it can help with fatigue, psychological distress, sleep disruption, and musculoskeletal symptoms. And then again, in the Eastern realm, I'd like to talk about Tai Chi and Qigong. So Tai Chi and Qigong are both ancient Chinese mindfulness practices. And they combine slow, deliberate movement, some meditation, and also those calming type breathing exercises. Both of these practices are able to improve circulation, balance, and then alignment, and particularly in the way that the postures or the sequences shift weight from one limb to another as you move slowly through the practice. It improves muscle control. Again, the attention is on the body, not on the gazillion other things. And it can be done in group classes or alone, outside in the grass like these folks are, or inside, of course. And then many classes these days are offered virtually. So my mom in particular loves her Qigong class that she does twice a week in her living room, all throughout the pandemic. And it really, these practices, just like yoga, engage the whole mind-body complex. And then I mentioned this earlier, some wonderful effort by the part of our lifestyle medicine clinic that both Sasha and I are a part of. We are a clinic that offers basically lifestyle conversation. We have a lifestyle conversation, I like to call it, with anyone with a history of cancer, followed at the cancer center. So both patients and even folks many, many years out from their treatments, we are open to seeing you. And we do talk about exercise. We talk about your goals, what's important to you. We also address other pillars of lifestyle medicine like nutrition, sleep, stress management, and a few other things. And our aim is to help to minimize side effects, prevent loss of function, and improve long-term outcomes. And that's our website here. If you're interested, please ask your provider to refer you. And then lastly, I mentioned that we had created several exercise videos. These are available right on that page. And they go from easy to more sort of moderate intensity to a bit more hard. We call it low, medium, hard, I think, or easy, medium, and hard. And they're only about several minutes each. I would recommend watching it first, at least a way through, and then maybe trying them at home. But there's also a yoga practice on there if you're interested in trying yoga, that I'm the teacher, and as well as a cardio dance. So if you really like music and movement, then you might enjoy that practice. So please check that out. And I believe that is our last slide. Oh, there's the website. Oh, I think I should stop share. Yes, Devin?
Yes.
Okay.
Thank you, Lauren. Thank you, Sasha, so much. A lot of good insights and tips there. We do have about 5 minutes left for questions, and there have been a couple that have come in. If you have a question and you haven't yet entered it, please feel free to do so, and we will get to as many as we can. You mentioned a lot of things to help with peripheral neuropathy. Are there any other things that I can do at home?
Yeah, so in terms of peripheral neuropathy, I think depending on what your specific complaint is with it, whether it's pain or impaired strength or balance, there's different avenues to take. And this is where sometimes seeing a physician or another provider is helpful just to see what you're specifically experiencing, because there's different treatment for all of them. If it's more pain, there's medications or different interventions you can use. Obviously, if there's weakness, proprioception or balance, related issues, then sometimes seeing a physical therapist and getting a good routine is important. It's also important to make sure you're exercising. One of the articles that Loren put on her slide, one of her slides actually, reviewed the evidence for exercise and peripheral neuropathy, and something simply as walking on a regular basis for exercise can really be helpful.
Thank you. And kind of similarly, are there any specific things that I can do at home to prevent strength and balance impairments?
So excellent question. And I'm happy to take a stab at this first. So in terms of doing things at home, making sure that you're trying to get up and move on a regular basis. I know a lot of us are working all virtually or predominantly virtually on the computer, or even if you're not working and you're retired. Sometimes setting a timer and making sure you're getting up and moving around every 30 minutes to an hour or so is really helpful. Even if it's just, a walk to the kitchen or a walk around the house or something, to try to stay on top of it and make sure you're not, sitting on the couch or staying in bed for prolonged periods. And then if it's a nice day out and you're able to in a safe way, of course, getting outside for a walk or doing other activities is good too.
Thank you. And a question about what you were just speaking about at the end there, Lauren. What is the difference between Qigong and Tai Chi?
That's a great question. So there are some similarities, but Tai Chi is actually considered more of a martial art, and Qigong is considered a bit more on the therapeutic side. I'm not an expert in either, but I can tell you that I have witnessed both practices in different locations. They're for someone who's a novice, they both seem challenging in the beginning, but once you get going and you know the poses and you know the movements, it becomes like a flow state. So again, if I was if I was going to make a suggestion based on those two examples, which one to start with, I'd probably err on the side of Qigong because it is a bit more slow, a bit more therapeutic based, and it's a good place to start. We actually used to have Qigong in the Cancer Center. Looking forward to bringing that back because I do think that we could see a lot of patients enjoying that.
Thank you. There are currently yoga classes going on. Very quickly, I'll just pull up a slide just to kind of show. So this here is their support and wellness calendar that has all of our integrated therapies and workshop sessions. And yoga is available a couple times a week for Cancer Center patients.
Yes, and I would say that our yoga therapist is just phenomenal. Loba Zagachan's been teaching yoga for a number of decades now to our Cancer Center population. She's very experienced and highly trained, and really is a goal of hers when she's working with individuals is to really work, even though she's in a group class, she's seeing each individual, she's making personalized suggestions and teaching people individually in a really, I think, specific way, very personalized way. So I'd definitely encourage folks to consider joining one of her classes.
That's great. And we have one last question, and then I'll just proceed and kind of wrap up. Are there meal suggestions to improve strength or meals or fatigue? And are there meals to avoid?
Yeah, so I'm happy to take a stab at this one first. So generally, in terms of improving strength, I always tell people you have to fill the tank before you expect it to perform. And one of the best things that cancer survivors and really all of us can improve upon is improving fruits and vegetables, yes, but really protein and making sure it's good protein. And sometimes meeting with a nutritionist can be extremely helpful in terms of figuring out where you can, sneak protein in your diet. Things to avoid are the good stuff. So things like fried goods, high sugar content, lots and lots of carbohydrates, and really focusing on the protein intake in terms of building muscle. That's what a lot of pro athletes do too. So I don't know, Loren, if you have anything else to add.
Yes, I would encourage folks to check out the MGH Nutrition Services website. There are some recipes, the Cancer Center Nutrition Services website. Maybe Devin can put that into the chat. It's got a beautiful picture of raspberries and blueberries on the front of the website that make me quite hungry. But there are recipes available on that website. And then, as I mentioned earlier, the lifestyle medicine clinic. If you are referred to see us in lifestyle medicine, the visit will include a consultation with a registered dietitian. And that is absolutely the aim of that consultation, is to talk about how you can use food as medicine, food to help support you in your recovery or survivorship, wherever you are. So please do consider that, or if you'd like, a dietitian appointment, you can certainly also ask your provider for that, either through lifestyle medicine or directly.
Thank you. And I'll put that the link to the nutrition website in the chat box, but it is massgeneral.org/cancer/nutrition.
Yeah, I just put it there.
Thank you.
Sure.
And that seems to be all the time that we have for this evening. Thank you again, Loren and Sasha, for being here this evening. And thank you everyone for joining us at home. We do have one last session going on tomorrow with a couple of our dietitians looking at treatment-related bowel changes and how to improve that through nutrition. Our previous sessions have all been recorded and are available on the Integrated Therapies page as well, and they are listed here. And lastly, just thank you everyone again for joining us. Do you have any final words? Thank you, everyone.
Thank you so much, Devin. Thank you, Sasha. And thank you, everybody who's joined the call tonight.
Yes, I agree. Thank you all for coming.
Thank you. Have a great evening. Bye-bye.